Hi everyone, welcome to a brand new episode of Explore and Engage with Anam. The healthcare system to most people is like a forest, a giant forest. To many people, it is a mystical forest. It is a forest of magical powers where people can go and their illnesses and ailments will be cured. Their health will improve and they will find the guidance that they need to have a higher quality of life going forward. But that's for a lot of people, but not for all. There are others out there who view the same forest in a different way. The forest of healthcare can be a dark and gloomy place too. Foggy, damp, with spine-chilling twists and turns. Some may feel that there's danger at every step, ready to shock the wary traveler. It is confusing, and many people seek to avoid this forest for as long as possible. Some of my listeners may say to me, "Now, why did you compare the healthcare system with a dark and gloomy and dangerous forest? That's not fair at all. Such an awful comparison." And others might say, "Hey, the healthcare system is good, but it's not so great that you would call it a magical forest with special powers. After all, it's a big, complicated system that might be hard to navigate." It all depends on who you talk to. On one hand, there are those who had to declare bankruptcy because of the burden of medical debt. Go and talk to those who are suffering because of excessive monthly payments on their outstanding medical bills. There are many who are having to choose between food on the table and making payments towards their medical debt. There are people who need healthcare services but don't know where to begin. Whenever we talk about healthcare, we talk about access, cost, and quality. Access is an issue for many people. Lack of access to insurance, lack of access to resources to pay for healthcare services, lack of access to good healthcare providers, etc. People who don't understand the healthcare system may struggle to navigate it. For them, the system may not seem to be a friendly place. I've talked to people who cannot believe how complex our healthcare system is. And for them, this system is like a dark forest. People can go in, but then they will feel lost. Let's keep in mind that often people need to access the healthcare system when there's no other option. It's not by choice, but by necessity. An accident, a major health problem, painful symptoms that need to be looked at without delay. These are the kinds of circumstances that many people face, and then they approach the healthcare system for services. And of course, on the other hand, there are those who are routinely accessing services, preventive services, periodic checkups, timely immunizations, etc. They may have the necessary knowledge and means to obtain services from the system. When they have any symptoms of illnesses, they can access primary care doctors, specialists, urgent care services, labs, and therapy services, and more. For them, the system may not feel as confusing and complicated. But that's probably the case up to a certain point. When people venture out into the unknown, driven by more serious healthcare needs, the American healthcare system can start to feel like a maze. What's really astonishing about the American healthcare system is that even if you are highly educated, successful in your own field, have decent resources to navigate the many complex situations that pop up in life in general, that still may not mean that you'll be able to successfully navigate the American healthcare system. Understanding the American healthcare system requires a special set of knowledge. Some of that is through academic work, and then a lot of that is gained through working in the field of healthcare or by researching healthcare policy. And many understand the system because they have some kind of professional connection with it, either as a provider, an insurance professional, a healthcare analyst, a public health professional, or some other capacity. And even then, it is not possible to know the entirety of how the American healthcare system works. And then pretty much all of us have our own experience as consumers of healthcare services. To be honest, you cannot possibly learn everything about the American healthcare system. And that's because it's always changing. New laws, new rules, new policies, new treatments, new illnesses, the changing political and economic climate, the changing demographic structure. Everything is changing, and so it's all about keeping up with what's new, what's coming up, what's the future. And that's time-consuming, and that's very challenging. For immigrants, the healthcare system is even more challenging. If you are someone who grew up outside of the United States and came to America as an immigrant, and now you need to become familiar with the US healthcare system, that can be quite a difficult experience. And I know it because I have been through it. Let me share with you some of my challenges. In Bangladesh, where I'm from, I never had any issues in obtaining healthcare services. Of course, my parents took care of everything. You can say that I come from a healthcare family, meaning we were always very well connected in the world of healthcare, and so we had full access to high-quality medical care in Bangladesh. The Bangladeshi healthcare system, for the most part, is an out-of-pocket system, meaning that you pay for care as you go. There are government hospitals too, and people who have financial challenges can seek care in those facilities. There are different tiers of providers, from high-end to those who charge very less. It is not a perfect system by any means. There are lots of problems, and I know that there are strong efforts to improve the system and make it better for everyone. Bangladesh being a fairly new country, and I call it fairly new because the country gained independence in 1971. So Bangladesh, as a fairly new country, has lots of challenges to overcome, and they are doing pretty well on many fronts. But that's not the topic of my episode. What I wish to convey to you, my listeners, is that right after I came to the United States, I had no idea about how this healthcare system works. I come from an educated background with strong English language skills from the very beginning. But after I landed in the United States, there was no one who could or who would guide me and inform me about the American healthcare system. And this, I believe, is a general issue that new immigrants face. They have a lot to learn about a new country, and perhaps many don't know who to ask, where to go, and what resources are available. As I was settling down in Madison, Wisconsin, I had to figure out health insurance for myself and for my mother. And what I found out is that I did not understand how health insurance worked. Terms like deductible, coinsurance, copay, prior authorization, I did not understand what these meant and how insurance worked. And the fact that I did not understand these terms, it was hard for me to accept. I never felt so clueless before. And this wasn't optional for me. I knew I had to figure out health insurance and how it worked. The in-network, the out-of-network, and so much more. Healthcare is full of terms that are confusing, that are hard to understand, and requires lots of research. My mother was not a senior citizen back then, but it was still important to make sure that she had good healthcare coverage so that she could go see a doctor and get prescriptions and get tests done as needed. And that's where we both faced tremendous struggle. As my mom applied for private healthcare coverage, she kept getting denied, and the company cited pre-existing conditions. It was simply ridiculous. Anyone in their 40s or 50s would likely have some pre-existing conditions, and the companies would just deny coverage. I kept searching on the internet and making phone calls and learning more about the health insurance companies and the plans they offer, etc. Throughout that struggle, the one thing I realized is that the world of healthcare is enormous, and internet searches would never help me figure this out completely. I needed to do something else. And so I did. I took a health policy class at UW-Madison. as an undergraduate student, the University of Wisconsin-Madison. I wanted to learn more about the healthcare system. For me, the healthcare system at the time was a giant forest. A forest so big that I had no idea how big. The more I learned about the American healthcare system, the more I realized that there's a lot that I don't know. I always thought of healthcare as a doctor-patient relationship. But there's so much more to it, as I realized when I studied the American healthcare system. Lots of entities playing their parts to make this system work. Doctors, clinics, hospitals, labs, administrative staff, medical coders, billing specialists, consultants, lawyers, insurance companies, people in government who oversee various programs such as Medicare and Medicaid, even collections agencies that go after people for unpaid medical bills, and so much more. Eventually, I became a healthcare policy analyst. An undergraduate healthcare policy class and the challenges I faced while trying to understand the American healthcare system led me to study healthcare policy during graduate school, and I ended up working on healthcare policy in my professional life too. And not only that, I write about healthcare, I talk about healthcare in my podcast, and I enjoy discussing healthcare. Studying healthcare policy and talking about healthcare is my passion. I enjoy doing it. And my knowledge of healthcare has made me make that comparison, that the healthcare system is a forest in a fairy tale land. And also that healthcare, the system, can feel like a dark and gloomy forest. It depends on who you're talking to, who you're asking that question. As I said, many immigrants find this system confusing. But the healthcare system is not something that you can avoid. Neither should you avoid it. The more we interact with the system, the more we pay attention to it, the more we can learn about it. How do we make the American healthcare system easy to understand? That's an important question to ask. How do we make the American healthcare system easy to understand? If the overall healthcare system is a giant forest, how can we provide people with a map that would allow them to go through this forest without feeling or getting lost? The answer is health literacy. Health literacy is something I've talked about before in a podcast episode. The priority would be to increase the level of healthcare literacy in the country so that people are able to make informed decisions about their own health. And any efforts to promote health literacy should also emphasize outreach in the immigrant community. The United States is a country of immigrants. Approximately 1 million foreign nationals get their green cards each year to live and work in America. Hundreds of thousands are becoming naturalized citizens every single year. In this country of immigrants, efforts to increase health literacy must include the immigrant community. As individuals, we must be proactive in learning about healthcare. It affects us all. If we think we're young and we don't need to worry about the healthcare system and how it works, guess what? Sooner or later, you're going to need to get help from this same system, from this very system. Understanding healthcare is like continuing education. So many things are changing, and so one must always keep up with the changes. An example would be telehealth. Telehealth is not a new concept, but it was during the COVID-19 pandemic that we saw a significant increase in the use of telehealth services. People who previously never thought about having a telehealth visit with a provider, during the COVID-19 pandemic, they started utilizing telehealth services. There are companies working on coming up with new ideas and to make improvements in the world of telemedicine. That's one area where we're seeing tremendous growth. And as needs change, the healthcare system adjusts itself to respond to new demands. For example, we have an aging population, which means that there will be greater need for long-term care services geriatric care, and other services required by elderly individuals. Accordingly, the healthcare system will respond. There are already efforts to train and prepare more workers to provide services to seniors. Many organizations in communities across the country are becoming dementia-friendly. There are organizations providing transportation services to seniors, as well as delivering meals to homebound individuals. Even things that are not directly related to medical services can be considered parts of the overall healthcare system. As in the case of most people, lack of proper nutrition can adversely affect health, and not having safe and reliable transportation can be a barrier to receiving healthcare services. And so these are also issues that must be looked at and addressed. So my point is, the population is changing. Needs are changing. Technology is evolving. New crises can lead to new ideas and adjustments. And so this healthcare system is always going through transformation, and we have to keep up with the changes. And so healthcare literacy is important in order to navigate this giant forest of healthcare. It seems like whenever I talk about healthcare, I just go on and on. So I'll end here. Share with me your thoughts. Send me a message. And I thank you all for listening, and I hope to be back again with another episode of Explore and Engage with Anam.